But let's take a minute to turn back to the news out of the CDC amid turmoil at the agency this week. In response to the firing of Director Susan Monarez, 4 veteran CDC leaders quit their posts in protest. Dr. Dan Jernigan was one of those people who left. He was director of the National Center for Emerging and Zoonotic Infectious Diseases and was one of the CDC's top flu experts as well. Doctor, thanks so much for joining us. And we know that you have been talking with your colleagues, that HHS Secretary Robert F. Kennedy has named his deputy, Jim O'Neill, as acting director of the CDC. What do you make of that decision?
Well, I think if I was in his position, I would want to have somebody that had a lot of scientific expertise, that had been working in government for a long time and understands public health. And so I can't speak to the track record for him, but I do know that there are individuals that really should be in these kinds of positions, dealing with science, dealing with good policies.
Are you suggesting that he's not?
I would say that he is probably an acting person. What I'm hoping is that whoever the secretary chooses as a permanent director does have that criteria. My concern, of course, over the last week was that a person who was a scientist, who understood working in public health, was fired and was not able to do that evidence-based approach to making policies and decisions at the CDC. And if that's the case for Susan Monarez, I'm not sure exactly what the incoming director is going to be able to do.
Now, there's been a lot of focus on the upcoming Vaccine Advisory Committee meeting in September. Senator Bill Cassidy has even asked for that meeting to be delayed. What are your concerns about that meeting, and do you think it should go forward?
We know that vaccines save lives. They improve the lives of Americans. They prevent death. They are incredible preventive tools. The ACIP, that advisory committee, is the way that we have an objective way of making decisions about vaccines. But the last advisory committee meeting was a complete lack of following the usual procedures for evidence-based decision making. If what we saw last a few weeks ago, is what's going to happen in just a few weeks here, I'm concerned that the outcome from that meeting will be recommendations that we may not be able to trust.
And in your resignation letter, you wrote, "I believe strongly in the mission of public health and the leadership that CDC has given for almost 80 years. However, given the current context in the department, I feel it is best for me to offer my resignation." You had spent more than 30 years at the CDC, and some may wonder why you chose not to stay and fight this battle from the inside. It was no doubt an important and painful decision for you. What made you ultimately decide to leave?
So I have been there for 30 years, and there are incredible scientists, very driven people that have been working for a very long time to make sure that the public is protected. My decision, along with 2 others, Deb Howery, who is the chief medical officer, and Dr. Daskalakis, who is in the immunization group at CDC, we made that decision together, and we did that because of what we saw happening to Dr. Monarez, where she was not able to do a evidence-based approach to things. So I had to make that decision. I think part of her firing was, in fact, that she was willing to stand up for us and not fire us. And so with her gone, I think our decisions were made for us, that a resignation made the best sense. But we are trying to do all that we can now that we're not there still to try and protect to protect Americans and make sure that public health moves forward.
And her lawyers say that she was fired because she refused to, quote, rubber stamp unscientific and reckless directives. In your role at the CDC, did you directly experience instances where politics, in your view, interfered with science?
Bottom line is that we need to get politics out of public health. What I experienced was requests for data, for vaccine safety data. Those vaccine data files and all that information were provided to others at the department to evaluate and make decisions that I believe will be coming out next week. That process is one that we don't know what the scientific practices they were using. We're not sure if they were adhering to the ethical responsibility for patient identification and privacy. So all of those things together make us need to rethink our engagement and make sure that we can do everything we can to protect public health, even though we're no longer at CDC.
Dan Jernigan, thank you so much for talking with us tonight.
Thanks a lot.